common cancer amongst Indian women, the good thing about cervical cancer is we know the reason for the cervical cancer. Unlike any other cancer, it has been found that the human papilloma virus is the reason for almost 99% of cervical cancer. So that means we know a reason and we have a means to prevent it also. And nowadays we have a vaccine against cervical cancer, that is against human papilloma virus. But not the vaccine is affordable for all women in our country considering our economic conditions. So what do we have to prevent the disease? We have what we call a pap smear test, which is a part of a cervical screening program. In developed countries, they have brought down the incidence of cervical cancer to a major extent because of an effective screening program. But unfortunately, in our country, we don't have an effective screening program even to date. So what we gynecologists do is, we do conduct camps in various populations to do cervical cancer screening for all eligible women. And also, when any woman walk to our clinic with any other problem, we take that opportunity to do a pap smear test. The major disadvantage is, even when we talk to our patients about the cervical cancer, about the importance of cervical cancer screening by a pap smear test, there is a lot of reluctance from their side to accept it. The immediate question they ask us is, "Doctor, I don't have any problem. Why should I go for this test?" That is the usual question that we face. So we have to take a couple of more minutes to counsel them regarding the importance of pap smear and its effects. So the next important problem when we talk about cervical screening is, many people think that it is a very painful procedure and a complicated procedure. It is not so. It is as simple as an internal examination done by the gynecologist. So all women beginning from the age of 21 should start having their pap smears done. It is not a one-time test. That is another important feature that everybody has to understand. It starts at 21 years of age and it has to be repeated every 3 years up till the age of 65 years. So if it is done effectively to a major extent, we can decrease the incidence of cervical cancer and the related deaths amongst the Indian population. As I told you earlier, when we talk about cervical cancer screening to any woman, first question they ask is, "I don't have any symptoms." And it is also important to understand that cervical cancer need not have symptoms all the time. Many a times, up to 50 to 60% of the time, it may not have any symptoms. So that is the most important aspect that every woman should understand, and they have to start going for pap smears regularly from the age of 21. The next common symptom a cervical cancer can produce is a foul-smelling discharge, a white discharge per vaginum, or blood that comes after having intercourse. Those are all the common symptoms that a cervical cancer can present with. And the most important thing, I want to reiterate the fact that most of the cancers are asymptomatic. That is, the woman will not have any symptoms at the time of diagnosis of cervical cancer. The important aspect of cervical cancer again is a preventable cancer, meaning we know the reason why it is caused. As I told you earlier, it is the human papilloma virus that is responsible for almost 99% of cervical cancer in women. Now, we have a vaccine against the human papilloma virus. So, in all the developed countries, they have started the immunization schedule for all their girls and also the boys from the age of 9 years. How many doses should we take? If we start between the age of 9 and 15, it is only 2 doses is enough. If you give the vaccine after 15 years, you have to take 3 doses at intervals of the first dose, the second dose being 2 months later, and the third dose being 6 months later. We have 2 cervical vaccines available in the market, and now a third one is also made available, which is quite expensive, which comes to around 10,000 per dose. And one word of caution when we talk about cervical cancer vaccine is, even though a girl or a woman is vaccinated against HPV virus at a younger age, be it 9 to 15 or any time up till the age of 45 years, they still have to undergo pap smear screening regularly. That is more important, because as we all understand, no vaccine is 100% protective.